Hi NSRD, it's Kali again. Long time no see. So today I'm going to talk about the best way that we can use some different protective equipment when we're out in the community and out in public. I've been meaning to touch on this one since I started this project, but I figured now's the perfect time because we just got some new guidelines about returning a little bit to normal life from Governor Walz. So starting with what Governor Walz announced yesterday, we've got some new executive orders. This first one I have got pulled up, details how some businesses are going to be able to reopen at half capacity. Now some of those dates, or one of those dates is going to be Monday, May 18th, and one is also going to be June 1st, depending on the type of business. Now that being said, this is not just returning totally to normal life. We still need to be cautious. So we're still maintaining 6 feet of distance. We are still limiting gatherings to 10 people or less. Don't be going out and doing things that aren't necessary for you to do. All right. I've been saying to people for the last couple days, this isn't the end of, or this isn't the beginning of the end. This is just the end of the beginning. We have quite a ways to go. There are still a lot of things that are going to happen before we're past this. All right. Now, the second executive order I wanted to talk about, and these were only 2 from yesterday. There's a couple more. But Governor Walz signed an executive order to protect employees. And so if you are returning to work and you are wearing protective equipment and you're being retaliated against for that, you can report that. Or if you feel like your workplace is not operating in a safe way or not keeping your safety in mind, you can report them and request that they be inspected. All right, so I will link both of these executive orders in the comments below if you guys want to take a peek and read through them. Now, before I jump into some different protective equipment that we can look at, the number one thing, and you guys have heard this a million times already, wash your hands. Warm water and soap for at least 20 seconds. Nothing can beat that. It sounds very elementary, but it's true. That's the best way we can stop the spread of germs. Now, you can also use hand sanitizer, but just be aware that hand sanitizer is not as effective as washing your hands a lot of the time. Even in nursing school, we were taught really if you've used hand sanitizer a couple times, I want to say the exact number was 8 times, now you have to wash your hands again. So it's not a complete replacement for washing your hands with soap and water. When you put alcohol on your hands, it just kills whatever's on there, but it doesn't take it away. When you wash your hands, the soap actually picks things up and takes them off your hands. All right. So the very first item we're going to talk about here is kind of a standard face mask. We've been seeing these everywhere. A lot of us are probably wearing these everywhere right now. Some of them are very cool and stylish. And so the thing you want to remember with masks like this is that their main goal is to keep your germs in, to protect other people from you. They might do an okay job at keeping droplets out and protecting you from other people's germs, but that's not really their main function. And so the main goal with this is that if we're all wearing face masks, then we're all protecting each other from ourselves because it's holding your germs in and not letting them get on other people. Now, with masks like this, you want to make sure that you wash your hands really thoroughly before you put them on so that the mask is clean when you put it on. Kind of a funny analogy I've heard to describe wearing masks like this is if you were to pee your pants and you had pants on, it's going to keep all the pee inside and it's not going to splash up all over other people, which is good. But if you pee your pants, or I guess I should say if you just pee and you're stark naked, your pee's going to splash all over everybody. And that's a pretty good representation of what these masks are trying to do here. All right. Now you can use bandanas or scarves or reusable cloth at home to use these if you don't have necessarily medical masks at home. Here is a CDC page that I found that talks about 3 different ways that you can make cloth masks at home. So I will link this below as well in case you are very savvy with the sewing machine. Now, the other thing with masks like this, folks, you have to cover your nose and your mouth. So I've got one sitting here. It's falling apart a little bit, so I'm not wearing this one out in public. But I've seen a lot of people wearing masks like this. It's not doing you any good because droplets can still get out of your nose, so it's not really doing anything. So you want to make sure that you're covering your face, your nose, and your mouth to make sure that it's being worn appropriately. Now, the next piece of protective equipment I'll touch on is N95 respirators. Some of us may have heard a lot about these recently. Now, some people do have some of these at home. They're used in healthcare a lot for certain infectious diseases, but they're also used a lot at home for, like painting, or sometimes if people are sanding or doing some other projects, they might wear these to protect themselves from particles. Now, the recommendation at this time is to not use these because we want to reserve them for our healthcare workers who need them in the hospital. And so I would not recommend you actively seek out to buy a lot of these at this time. If you already have some at home and you've got an open box of them perhaps, I don't even know that you'd be able to donate them if you wanted. But I would just say if you've got some at home and you're using them, okay, but probably don't seek out to buy more at this time so we can save them for the nurses and doctors and other healthcare workers. Now, if you do have a couple of these and you want to wear them at very strategic times, there's a couple things you need to keep in mind. It's very important to have a tight fit with an N95. You have to have it perfectly sealed around your face with no air leaks for it to be effective. And so if you talk to healthcare workers, you'll learn that they have to go through what's called fit testing at least once a year. And so our healthcare workers have to try these on and make sure they still fit year after year so they can wear them. And so what we find is that if people have different facial hair, or if people, if your face changes shape because maybe you have gained or lost a little weight perhaps, they may not fit appropriately anymore. And so if you're feeling any leaks of air coming out from around an N95, it's not really protecting you as effectively as it should. Now, the next thing I want to talk about is wearing gloves. Now, a lot of people feel like wearing gloves, just kind of standard latex gloves, is a good idea right now. And I don't really think it is, to be honest. And I'll tell you why. If I'm using gloves appropriately in order to prevent infection, I am taking them off and putting new ones on constantly. I'll tell you, using gloves appropriately in healthcare is a pain because you're just constantly changing them. So if I've got gloves on and I have to touch my patient for some reason, now they're dirty. If I have to go touch something else, now I got to take the gloves off. And you always have to wash your hands before and after putting gloves on, or before putting gloves on and after taking them off. And so even being in one room with the patient, if I'm just doing a couple things, I might be taking my gloves on and off several times and washing my hands several times. And so what you want to keep in mind with gloves is as soon as you touch something dirty, your gloves are dirty. It's not like there's magically no germs on them just because it's gloves. And so if you're at the grocery store somewhere else and you've got gloves on, but you're touching this shelf and you're touching this product and you're touching the cart handle and then the doorknob or something, all of those germs that were on those surfaces are now on your gloves. And so if I reach in my pocket to grab my phone, or I reach in my bag to grab my wallet, or I try to pull my hair back in a ponytail, well, the gloves didn't do anything for me because I just spread around all the germs like I would have without gloves anyway. So in general, I don't know that it's a super great idea for everybody to be wearing gloves right now. Again, these are resources we want to save for healthcare workers. So the best thing you can be doing, again, is just washing your hands super frequently. If you do choose to wear gloves, however, just keep in mind they are not reusable. If you wear them and they're dirty and you take them off, you're done. You have to throw them away. You can't put them back on. Now, another one that I think is pretty interesting, folks, is eye care. This is one I haven't heard a lot about, but it is kind of important. Now, the page I'm on here is the American Academy of Ophthalmology. And so this page talks about how COVID can actually spread through the eyes. And it does make sense because if we think about those droplets from other people, like if they cough or sneeze, those droplets can get to my eyes just like they can get to my nose or mouth. And my eyes are mucous membranes, just like in my nose and in my mouth. And so if somebody sneezes right in my face, those droplets can get in my eyes. Or if somebody has sneezed or coughed on the surface next to me and I'm touching it with my hands and then I go to rub my eye, well, I can be transferring that into my eye as well. And so again, make sure your hands are clean and you're washing them frequently to prevent that. And a couple other interesting recommendations from on this page. Um, Let me see if I can scroll down a little bit and find these recommendations. Here we go. So if you have to wear contacts or glasses, um, potentially a good idea to switch to the glasses for now because it looks like they have found that if you're wearing contacts, you're going to be rubbing your eyes a lot more. And so switching to glasses will prevent you from touching your face quite as much. The other thing you can do is throw on a pair of sunglasses or normal glasses to protect your eyes a little bit. Now, it's not going to be perfect or 100% protection because, you know, if I throw on my sunglasses here and I'm wearing these in the store, I've still got gaps up at the top and on the sides here. But if somebody sneezes directly onto my face, all of this is going to stop any droplets from getting onto my eyes. And so, looks kind of weird, but walking around with sunglasses, even if you're inside, isn't the worst idea ever. And then one I hear a lot of questions about is, do I need to change clothes after I get home from being out? And I'll be honest with you folks, this one is tricky. There's not a lot of um, really good resources out there about this. This is the best one I found, and it's from back in March, and we've learned a lot since then. So this is maybe even not the most up to date at this point. This page is also geared towards medical staff. And so if you don't work in a medical facility, this is maybe even overkill for you. So with clothes, not a lot of official recommendations out there. It's not really clear that the virus can survive on your clothing in any meaningful way. We know it can survive on some surfaces, but just because the virus has survived on a surface doesn't necessarily mean it can be transmitted to somebody from that surface. Now, I think if you're worried about clothing, you should be critical of where you have been. Because if you're wearing, if you're wearing a fluffy sweatshirt, like some of those fleecy ones, and you're at a grocery store and you're bumping up against a shelf and then you're rubbing up against a cart or leaning on something or brushing up against people, hopefully they're staying away from you, but maybe not. Maybe I'm a little more worried about what could be on my shirt at that point. But if I just go outside for a jog and I'm not really around anybody, I'm not nearly as worried about what's on my clothes in that case. And so there's certainly nothing wrong with coming home and deciding you want to change clothes and throw them in the washing machine. That's, maybe it's overkill in some cases, but it's not really a problem. You could certainly do that if you want to. And if you wanted to, you could even wear layers if you're really worried about it. It's getting harder to do that as the weather is getting nicer. But if you wear layers and you're worried about being contaminated, you can always slip off your top layers and have clothes on underneath too. All right, and so that's really it as far as protecting our bodies and using things on our bodies for protection. The last point I really want to talk to you guys about is just making sure we're cleaning things up at home. So make sure you sanitize your doorknobs often, wiping down counters, making sure you're cleaning high traffic spots. And then one thing to think about is your sinks, because we're washing our hands so much and we're turning on the faucets and touching the sink and water is splashing everywhere. Make sure you're cleaning your sink and faucets regularly, because if it gets on there, it can still be transmitted to other people. You know, if you have something dirty on your faucet and then you wash your hands, but then you touch the handles again to turn it off, you maybe didn't help yourself all that much. So just a thought. All right, that's all I have for you folks today. Like always, I hope you're staying safe and staying healthy. I'm going to continue working on some of these. So if you've got some recommendations or again, questions, concerns, or you need to talk to somebody, just shoot me an email and we can chat about whatever it is going on. So I hope to talk to you guys soon. Have a great rest of your evening.